Hello and welcome to the second presentation of the uses of hypnosis in psychotherapy. In the first presentation, I showed you live footage of a client called Frances who suffered from anxiety so serious that it affected her ability to live an ordinary life. And I told you about how I would personally really struggle to treat complex anxiety if I hadn't been trained in hypnotherapy. Because, as you saw with Frances, using hypnosis to calm her down enabled her to stop feeling so emotional and be able to use the thinking part of her brain to problem solve. After just one session, we saw how she was visibly more relaxed and smiled a lot more. And it was really rewarding for me to know that Frances had a much better week between our sessions and had in fact already overcome her most significant anxieties. And that gave me great confidence that after a few more sessions, she'd feel better than ever. What I'm doing in this presentation is giving you a more in-depth look at the guide you can download from this page called 3 Hypnotic Techniques for Non-Hypnosis Practitioners. So if you haven't already got that, you can download it below. But first, I want to reassure you, over 20 years I've taught medical doctors, psychologists, psychiatrists and counsellors, and in fact therapists of all kinds, how to naturally begin to incorporate conversational hypnosis into the work they do so they can be more successful. I see the skilled use of hypnosis as not something alternative, but rather complementary to all ways of working. I say this because hypnotic communication can be valuable in all contexts, but especially ones where how you communicate can actually help people heal. So conversational hypnosis doesn't have to just be for counsellors and psychotherapists or massage therapists or for hypnotherapists. Hypnosis can be learned by anyone who wants to become a more powerful and influential communicator or to heal with words. We've even had teachers on our courses who want to be able to capture their students' attention more effectively. That's why I'm encouraging you to think of the skills of hypnotherapy in a much wider context than just close your eyes now you're feeling sleepy. What you learn about language and psychology when you learn uncommon hypnotherapy will serve you really well in all kinds of areas in life. Some people still have an idea that hypnosis is somehow weird or strange, and in a way that's not surprising because people, even professionals, can become kind of superstitious about anything that seems powerful when they don't really understand it. So just as penicillin can seem miraculous and be endowed with supernatural associations in someone who's never experienced modern medicine before. But I think perceptions of hypnosis are changing. And one thing I found is that when a practitioner has a reputation of being able to successfully help people feel better fast, then those suffering won't care what technique they used. Okay, people living with post-traumatic stress disorder or depression or addiction just want to feel better. And if you can do that for them in a way that makes them feel relaxed and confident and improve their self-esteem, so much the better. We're also seeing hypnosis taking a more and more central role in healthcare. One recent news story showed how firemen in France were even taught conversational hypnosis to help them calm people down during and after emergencies. And one of our recent practitioners in Focus, Alina Guest, is a medical support hypnotherapist in a hospital. Now that's the sort of change I think we'll see more and more of. So let's get down to business and look at the first of the 3 techniques I promised you, the affect bridge. Now, although this is used in other therapy modalities, this of course is a hypnotic procedure. An affect bridge is simply using emotion, affect, to access a memory through first accessing feelings or sensations that prompt that memory. So originally this was used as a way to discover what painful memories might be associated with a present problem. But there's a whole other way of using this. So when treating a phobia or post-traumatic stress disorder, people can use the same affect bridge process to help someone access resourceful feelings of safety and calmness, which is essential to keep them comfortable while you get rid of the PTSD or phobia. And I'll give you an example. I was working with a severely depressed man, and the depression was blocking him from accessing any feelings that were empowering for him. And I asked him to think about a time in which he had felt calm, humorous, and capable. And he told me that no such time had ever existed. Okay, so that was me trying to access resourceful feelings by appealing to his conscious mind, and you've probably had the same experience. Nothing had ever been good for him. Of course, with clients, we need to know how to appeal to their unconscious mind too, which is so often where the capacity for healing comes from. So I began to hypnotize my client so that his unconscious mind could enable him to relax deeply. I spoke to him about the physical sensations of smiling and feeling comfortable. I reminded him of how it feels to be in a performance flow state. I wanted to remind him of that state where you don't even think about being able to be competent and happy because you just are. And I talked of feelings of togetherness and purpose and beautiful meaning permeating him. And for those moments, he totally broke through the depression. Not one memory, but 3 resourceful memories came to mind, breaking through the biased restrictions, the negative propaganda of the depressive state. And this happened because of the way we'd used an hypnotic affect bridge to good effect when trying to recall good times via the conscious mind just didn't work. So if you don't have the skill of hypnosis, then the affect bridge can still work, but it will be less powerful because really we're seeking responses from the unconscious mind, so appealing to the more conscious part of a person may seem a little clunky. But if you haven't been trained in hypnotic language, simply ask your client to focus on the idea of what it feels like to feel resourceful. Okay, so rather than saying, remember a resourceful time, you could give them a menu of resourceful words they can connect to, like confident, content, curious, relaxed, tranquil, or energized. And ask them to think about the reality of actually feeling those things, and perhaps ask where those feelings might manifest in the body to help them focus on them even more strongly. Okay, so let's look at our second hypnotic technique for non-hypnosis practitioners, amplifying a resourceful state. So once we've accessed a resourceful state of mind and body in our clients using the affect bridge technique, we can do the next positive intervention, which is to amplify the resourceful state. In other words, get them to feel it even better. And doing this is no small achievement, given the state many clients are in when they walk into your therapy room. So the idea that we can build their positive feelings up so that it's not just a dim feeling of once having felt quite good, but an immediate and powerful and all-pervasive feeling of empowerment or humor or feeling loved and optimistic and energetic and so on. So using hypnosis, it can be pretty easy to do this, even in the most anxious or depressed clients. But therapists don't just do this to help clients take a break from feeling bad. We amplify resourceful states to enable clients to become better at accessing those resourceful states in their everyday lives, so it becomes easier for them to meet their emotional needs. States like depression, addiction, low self-esteem, and generalized anxiety disorder so swamp a person with disempowering feelings that it becomes difficult for them to meet the kinds of emotional needs that make life worth living. So if you don't know hypnosis, here's how you do it. Simply ask your client to imagine what it would be like to notice a wonderful increase in those feelings. Perhaps even visualize those feelings as a color becoming brighter or an increase in physical sensation. You could ask them to nod their head once they've noticed an increase in the intensity of positive feeling, and suggest they're going to become really good at increasing the volume and concentration of good feelings in that way when they need to in future. Even if they're not great at doing this right away, the subtext is that they have a level of control over how they can feel in the future, which is a therapeutic idea in itself. Okay, good stuff. So now let's look at our third technique, something I recommend all therapists be able to do, which is called resource bridging. So since we've now used the affect bridge to locate a memory or a feeling which makes our client feel positive and confident, and we've amplified those feelings so they can feel it strongly, now we want to help them get that feeling into a place in their life where it's going to be really useful or even transformative for them. And this is a common problem. People can feel great in one situation, but terrible in another. So someone might be able to feel really relaxed with family and friends, but feel really anxious during a work meeting. If we could help them take the good feelings from one situation, being with their family, and help them transfer those feelings to another, being in the meeting at work, then we've effectively helped them expand their life. We're using what they already have in somewhere else. And this is the bridge connecting one area of life where they have the resource they want to another area where they're currently lacking it. Of course, therapists don't just use hypnotic resource bridging when preparing to help clients soothe traumatic memories, but in all other kinds of contexts too, such as helping people overcome alcoholism or chronic anger, or of course low self-esteem. And it's important to really appreciate that hypnosis is not a therapy but a medium or delivery system to make all kinds of sensible therapy much more effective. The wonderful thing about using conversational hypnosis as part of your work with clients is that they're less likely to feel bad during therapy and much more likely to enjoy the therapy and find it helps them. It won't feel like a clunky technique you're doing on them, but as a congruent way of conversing. Okay. But sometimes clients do experience strong negative emotion. So in the next and final presentation, I'll give you a simple 3-step procedure to help you quickly take a client from emotional upset to calm. So this is something so quick and easy and reliable that you'll find yourself using it to help anyone who's upset, whether that be clients or kids or friends. But before you go, can I ask you a question? I'd like to hear from you if you've realized that you have any preconceptions about hypnosis that have become clear while watching these presentations. And I'd really appreciate it if you could put any thoughts you have on this in the comments section below. Whether it's a preconception you've got rid of during these videos or questions about hypnosis that are still unanswered for you. And if there was one particularly strong takeaway that really struck you from these videos, please let me know about that. And by the way, preconceptions about hypnosis are not unusual in the therapy community, so don't worry. I've often met people on my courses who will shyly tell me that they held back from training in hypnosis because they thought it was weird, and I don't blame them. I thought the same thing before I trained in it. We've also had many students in the past who took our course who were already hypnotherapists but felt there were gaps missing in their training, that they couldn't do it congruently or conversationally. Many of them had been taught to read from scripts or instead of being taught flexible techniques like the utilization principle. And many of them have told me while they've learned lots and lots of theory, they never learned the nuts and bolts of exactly how to help clients with depression or anxiety or other common problems. It was all theory, but not so much practice. One student told me it was like a plumber being taught all about the history of pipes and the chemical compounds of lead, but not actually how to unclog a drain. Anyway, that's enough from me. Please let me know in the comments section what you thought of this video and your questions about hypnosis. I read and answer every comment we get. And see you again soon with that trick for calming people down quickly.